Everyone. I'm Juan Dumois. I'm one of the pediatric infectious disease doctors at Johns Hopkins All Children's Hospital in St. Petersburg.
Thank you for joining us, Dr. Dumois.
You're welcome.
I'm 10 News digital journalist Samantha Mitchell, and Dr. Dumois here was kind enough to take time away from his busy schedule to come and talk to us. And you know, one of the biggest stories right now, of course, is this polio-like disease that's been affecting so many children.
Right.
And now you're saying that there's 2 confirmed cases out of Jacksonville? Is that correct?
At least one, I think.
At least one?
Yeah.
Okay. Could you talk a little bit about the disease and how it's affecting children?
Sure, yeah. This disease is called acute flaccid myelitis. And because of that term, they're abbreviating it AFM. That's a lot easier to say. So this AFM is a condition that causes sudden weakening of the muscles in the arms and legs. And it can get even worse than that. And it's being called polio-like because it very much resembles what we used to see with polio a long time ago. Okay.
And so what are some, is it fair to make the comparison, I guess, then to polio with this new disease?
It is fair. The symptoms that we used to see with polio back in the 1950s were very similar to what we're seeing now in many of the cases of AFM.
And could you explain to us a little bit about the symptoms that parents should be looking for?
Well, the main symptoms that you would look for are that if your child happens to have gotten sick recently and all of a sudden they seem to be weak in a leg or an arm, that in a way that's obviously not normal in how that leg or arm normally functions, that could be one of the first signs of it.
Okay, so it's more than just like a fever or a cough or something. It's like it's a numbing sensation, you're saying, in your arm or your leg maybe?
It's not numbing, but
okay.
it's a weakness.
Weakness,
so
okay.
An inability to use the arm as they could before, say to grab something or to feed themselves, or an inability to walk or crawl the way they used to be able to do. It's just a sudden inability to do what they could do before.
Okay.
The child may not even be old enough to be able to express that they feel something different. A numbness is not a common symptom. Older children with this do not say that they have numbness, but they may have pain.
Pain.
Just pain in the muscles of the arms or legs.
So if a parent were to, let's say, have their child come to them and say, hey, Mom, Dad, I have this sudden pain and unexplained pain in my arm, and I'm starting to feel different, what would you suggest a parent do?
They would probably just look at how the child is able to use that arm and just get them to do one of the normal common things that they like to do, whether it's to play with a toy or to hold a cell phone while they're watching a video or to feed themselves. And if they seem to be able to do that okay, there's probably nothing wrong with the strength of that arm. But when the strength is abnormal, that's when you have weakness. And if they seem to be unable to do something that they normally could do, then they have weakness.
Okay, interesting. And guys, just to let you know, I'm answering a lot of your questions, so if you guys have any questions for us on the 10 News Facebook page, just let us know. I'm monitoring the questions right here. Let's see. And do you guys have a certain test? Let's say, like, if a child did come to a parent and say, hey, you know, I'm feeling this way, I'm feeling this weakness. Is there a test that then parents can guide their children into taking to test for this disease?
If a parent is concerned that their child has new weakness that might be a part of this disease, there's no specific test that they are to ask for. They just need to take their child to their doctor, who then begins the evaluation of whether or not it's likely that they have this. There are other conditions that are not AFM that can also cause weakness. So in part of the doctor's evaluation of that child who has sudden weakness, they're going to be looking for evidence of other things as well. And depending upon asking questions about the recent illness and doing the physical examination, the doctor may then decide, you're fine, you can go home, nothing's wrong here. Or they may say, we need a little bit more evaluation, let's put you in the hospital and we can do fancier tests there.
Got you. Okay. And we have a couple people asking, where have a lot of the more recent cases been?
The cases in the United States this year so far have been scattered all the way across the country. There has not been a single focus. There hasn't been much in Florida, although there was the recent case that was reported today about the case up in Jacksonville. And I'm not aware of any recent cases here in the Tampa Bay area. But we're on the lookout for that, and we know to look out for it if we see a child come in with sudden weakness.
So you're saying that the reported cases in Jacksonville, not here anywhere locally for parents so far?
Not that I know of.
Okay. So that's good to know for us. Do you guys have any idea about clusters and spots and single cases and others?
Well, what we know about this disease is information in the United States for the last 5 years or so. And in some cases, there have been small clusters. Clusters have been described in specific states like California or Colorado, Missouri, whereas other cases were totally individual with no other cases nearby. So it seems that we think that these cases occur when a child gets an infection, but they otherwise had some sort of risk of developing this condition because the vast majority of the kids getting the very same infection are not going to develop AFM.
So is this some sort of like immune issue?
It could be, but we don't know.
Okay. Interesting. Okay. Can you see now, going back to our previous conversation, the comparison to polio, can you see now the concern that parents have for this?
Yes. And I think it's a valid concern. I don't think we're overstating it. We know that some of the children who've developed AFM over the last few years have recovered completely, although sometimes requiring months of physical therapy for that recovery. But some have had permanent problems with weakness after their recovery.
So this could be more of a long-term.
For the children who get it, it can be a long-term problem for the rest of their life. I don't think it'll ever be as common as what we used to see with polio before the polio vaccine was introduced.
Okay. So what are some of the long-term effects, would you say, that you guys can determine?
It's mainly going to be weakness to the extent of not being able to walk in some cases, or not being able to use one's arms at normal strength. They may or may not be able to move their arms, and if they can, they may not have the normal strength that they had before. They may or may not be able to walk. In some cases, like I said, they can recover completely and be totally back to normal, but it takes a while to see that recovery. In the first few weeks after a child develops AFM, we can see very little improvement, and it's really a matter of months for us to see that improvement.
And we've had some controversies over vaccinations versus, the anti-vaccinators out there. Is there a correlation to any of the vaccines out there right now to this disease?
There has been no link to the vaccines as a consistent cause of this. Now, there may have been occasional cases where there may have been a coincidence in time that someone got sick soon after a vaccine, but the vast majority of AFM cases are associated with a cold or a diarrhea illness. So stomach flu or a respiratory illness. At least 80 or 90% of the kids have a recent cold type illness that seemed to have been the trigger for it, not vaccines.
Interesting. So let's see if there's any more questions. Let's see. Oh, that reminds me of when I spoke to Courtney Robinson about this. She's one of our 2 news anchors. She wanted to know, so this kind of all started to come back in 2014?
Yeah.
Originally?
Well, 2014 is when we first started to hear reports of clusters or outbreaks in the United States. Before that, we've known about this condition for a long time, and I'd seen cases before 2014, but one every few years, not very commonly.
So has it become more prevalent since 2014?
That's a really good question. It could be that we're noticing it more now because it's more prevalent, that it's more common. It could also be that there were cases before that just weren't recognized or weren't communicated. The whole reporting in 2014 occurred because someone noticed a small cluster and they decided to report it to the Centers for Disease Control in Atlanta. And without that report, nothing would have happened. That there may not have been the recognition that the CDC should then send out a nationwide alert to start looking for these cases. So I'm not sure if it really started in 2014, but that's when we recognized it was something to look for.
And have you seen a spike since 2014 up until now?
It seems like cases rose into 2016, went down last year, and maybe now they're rising again.
Interesting. And going back to polio and vaccinations, does it help? And I know the diseases are two different things, but does it help for your child to get, let's say, a polio vaccination?
The polio vaccination we don't think that would likely help in preventing this, because all these children with AFM have been checked for polio and none of them had it. The vaccine works very well at preventing polio. So I'm not saying they shouldn't get the polio vaccine, because you can still get exposed to polio when you leave the country. But it's not likely to help prevent this.
Okay. And I've heard that this disease can actually have other underlying diseases as well, like the West Nile. Is that correct in saying that, or?
There are other there are some specific possible causes of AFM that we think, or that in certain individual cases they've found West Nile virus, and we know West Nile virus can sometimes cause this, along with some of the other symptoms caused by that virus. We know that there's a big family of viruses called enteroviruses, and some of the patients with AFM had good evidence of just having had an enterovirus infection, but not all of them. In some of the clusters, a lot of the kids had the same strain of enteroviruses, because there's a bunch of strains. But then in other clusters, none of them had that virus. So it's possible that different viruses may be the trigger for AFM.
And some of the more extreme cases that you've seen, what are some of the symptoms that you would say that the children have experienced? I know you spoke a little bit about weakness, or not being able to move.
Also see weakness of the muscles in the eyelids, so the eyes look droopy, they look tired, and it's really just weakness of the eyelids. The weakness can become more severe than that and extend to the breathing muscles. So it can get as bad where a child can't breathe for themselves. Weakness that's really out of the ordinary for how your child normally uses an arm or a leg.
And the chances, as you mentioned, are very So sorry guys, we're having some internet connection issues, it looks like. Let's see. I think that's kind of the gist that we wanted to ask you as we talked before prior to this interview. You know, just making sure that parents, like you said, don't just come in for every time their child has a cold or every time their child gets a fever. Knowing that this is definitely a disease to be concerned about, but also not panicking, as you mentioned before, every time your child gets sick.
Right. Yeah. That's pretty important.
All right. Let's see. Sorry guys, some internet connection issues. I know a couple people have commented on that already. Let's see. And let's just circle back one more time for everyone in case they came in later about symptoms to look for as well as your recommendations.
Okay. So the symptoms of acute flaccid myelitis, or AFM, are really going to be weakness, usually of an arm or a leg, to where what you're noticing is that your child can't do something that they were able to do easily before, whether it's feed themselves, hold a toy, hold a cell phone, crawl, or walk. If suddenly they can't do that, it could be due to weakness. Sometimes they'll have pain, but they don't have to have pain. It could just be weakness without the pain. And most of the time, they've had a recent cold or fever.
Okay.
And so my recommendations would be that don't worry about AFM if they just have a cold or fever. But if with a cold or fever you suddenly see something that isn't working right with, again, some of the muscles in the arms or legs, then that might be the first sign of it. And what you do then is take your child to your pediatrician or to an emergency center, and they can do a further evaluation and see what's going on. In some cases, when a child has a fever and they stop using their arm, it's not because the arm is weak, but because there's pain from an infection in the shoulder joint. Totally different condition. It's not AFM, but it's something that is serious and needs to be treated.
And how have you noticed that this has been spread? Do you think it is spreading a certain way?
In some of the cases where we have identified in a cluster that a certain virus was associated with it, most of the viruses are spread by direct contact with another person's saliva, for example, or nasal secretions if they're sneezing. Lots of virus can be found in the liquids coming from our nose and mouth when you have a cold. And as I said, most kids with AFM have a cold, and they probably got the cold from someone in the family or another contact who had a cold. But in most of the people who caught that cold, nothing neurologic happened, and in this particular child, for whatever reason, they developed the AFM. With West Nile virus, though, that is not transmitted person to person. That is transmitted by mosquito bites.
Interesting. And there's a couple people on here who are asking about vaccinations going back.
Mm-hmm.
This is not caused by vaccinations.
Yeah,
correct?
So far there's been no evidence that vaccines are a cause of this. So it really seems to be infections that are the trigger for AFM.
Interesting. All right.
Now, vaccines have been linked to other neurologic conditions, but different ones, not this one.
Not AFM.
And correct.
Mm-hmm.
And some of those cause muscle weakness or muscle paralysis, but they're not AFM. They're other conditions like Guillain-Barré.
Similar, but not the same as this.
Correct. So it's easy to get those confused, but they are distinct conditions, distinct diagnoses.
Is this condition just specific to children, or have you noticed adults as well?
There have been some adults diagnosed with AFM, but at least 80% are children.
So this is more common for children.
Way more
to
common
develop.
in kids, yes.
Okay. All right. Do flu shots help at all?
So far, I'm not aware of any association between AFM and the flu. So I can't say that flu shots would help prevent this. But until we know what's causing the AFM cases now, I can't say that it wouldn't help either.
It's always best, as you mentioned before, to just go ahead and get vaccinated in case the other issue arises.
Oh yeah, the flu can do a lot worse things than AFM. The flu kills at least 15,000 people in the U.S. every year, and it was more like 30,000 last year, and that's way worse than AFM.
Interesting. Well, keep your questions coming, and everyone will try to get to them if we are able to. But I think we kind of have the gist of what we were looking for. Just kind of reassuring parents, as we mentioned before, what to look for, when they should consult a doctor, what kind of clusters are we looking at, let's see, how similar it is to polio, because, and as you mentioned before, going back to that, would you say that it is a fair comparison to polio?
Yeah, it's a fair comparison. The symptoms are very similar to polio. And in fact, some of those viruses that I mentioned, enteroviruses, have been associated with some of the clusters of AFM. Polio virus is a type of enterovirus. So those are related to each other. And so it kind of makes sense that they could potentially cause similar symptoms.
Well, thank you so much, Dr. Dumoy. It's been a pleasure talking to you, and thank you for sitting down and chatting with us today. It's been really interesting.
You're welcome.
And until next time.
Okay.
Thanks again.
You're welcome.